Good evening. BC's healthcare system is preparing for the unknown as the Omicron wave batters our province. And now the question is, what can be done to prevent hospitals and staff from becoming overwhelmed?
As CTV's Binder Sutton reports, one of those plans includes a last resort of setting up a makeshift field hospital.
With uncertainty around what Omicron will mean for an already strained healthcare system, contingency plans are being put in place for staffing and beds,
including potentially converting the space we're using right now for the mass vaccination clinic at the convention center, and could have a hospital set up in 5 to 7 days.
In 2020, the province set up a field hospital there that wasn't needed. The new COVID-19 variant may change that, so the province is looking for space.
We are not moving to stand up a field hospital this time, but of course, we want to have all of the options available as we go through these difficult weeks.
Hospitalizations are rapidly increasing, and independent modeling expects the trend to continue.
Even at the lowest prediction that we make in our models, 2,000 people in hospital, that entirely overwhelms our system.
Although Omicron has many unknowns, what the data does show is that hospitals are disproportionately full with the unvaccinated.
Right now, we have 3 people in ICU in this province who are unvaccinated people in their 20s, and we have 1 person in their 30s in critical care.
Dr. Bonnie Henry says transmission will be high for several weeks. Her focus balancing the need to keep things open while not overwhelming hospitals and staff.
The restrictions on gatherings and events are likely to remain unchanged for now.
Quebec announcing it's going to send large bills to the unvaccinated, but that's not in BC's plans.
I don't foresee making it mandatory for vaccinations for everybody in the province.
We won't be taking the same action as Quebec.
1 million rapid tests arriving this week, 850,000 more expected next week. The health minister insists they're being deployed where needed. By the end of the month, new antivirals to treat COVID-19 may also be approved for use.
And we're hopeful that those will be available, another important tool to help us keep people out of hospital.
Another tool, vaccinations. Adrian Dick says as of Tuesday morning, nearly 500,000 appointments were available. Binder Sutton, CTV News, Victoria.